Today, I want to give a special shout out to Ari Melville for recognizing that it is not just what you do, it is also what you say. But what you say
Can
can
lead to what you can do.
absolutely. So, we're going to go on and get down to business. And we're going to honor our Bernie Sanders, who championed the health care for over 20 plus years. So, first of all, Wood, who's Bernie Sanders?
He is the senator from Vermont. He was the former mayor of Burlington, Vermont, former congressman from Vermont, and two-time presidential candidate, and
Ber-
current chairman of the Budget Committee.
Bernie Sanders had a lot of goals that he fulfilled, and he had a lot to tackle. But we're just listing five of those goals because we want Gen Z, Gen X, and
Millenniums, my generation, millenniums, and Generation Alpha.
to understand that their health is a priority. So, we're going to go to universal health care coverage. What did Bernie Sanders champion with universal health care?
He championed universal free single payer health care known as the Medicare for all.
And this system will provide comprehensive health care to all Americans, regardless of their income and their employment status. Next, we have reducing health care costs. Tell us about that.
He was trying to reduce healthcare costs by negotiating, the government negotiating with the pharmaceutical companies to get the drugs cheaper or bringing drugs from different countries to increase the competition.
And capping out of pocket expenses for patients and eliminating administrative waste associated with the current fragmented healthcare system. Now, could you explain the administrative waste associated with the current fragmented healthcare system?
That's English language word for, and street talk word for paperwork and bureaucracy.
Getting rid of the what?
Getting rid of bureaucracy and getting rid of the paperwork and getting to the treatment.
Red tape. Because what happens when you have so much red tape?
You're not going to get to your care. You're going to die before you get to the emergency room or to your regular doctor.
And if they kind of get their little paper shredder and get rid of all that red tape, the patients would get better treatment, quicker treatment, and it would benefit the healthcare system for as efficiency and being effective to helping patients.
Not only helping patients, but it will be saving money for the taxpayers, just like the blue zones.
Absolutely. So what did the blue zones do?
They have single payer health care and they made health care as a basic human right, not privatization, not a privilege, like some of the Republicans and Libertarians. Libertarians and Republicans believe that health care is a privilege, not a human right.
Absolutely. And for years, Bernie has told Americans that, you know what? We need to get on board. We need to be looking over there what the blue zone is doing and kind to not mimic, but, kind of copy their system because they are living longer. And since, you're coming out and saying we're 80 and we're old, the blue zone is not worried about their age. They're living it
They're
out.
living happiness, and we as United States Americans, as Western society, just in the United States, is chasing happiness, chasing that bag.
Chasing the bag and not living long enough to what?
Not living long enough to enjoy it or enjoying the fruits of our legacy in our decision-making process.
Now, we are a mental health channel and a health channel. And the next one is improving access to mental health service. Tell us about that.
With mental health, you cannot separate mental health and physical health. Once your mental health is gone, it can destroy your body. Once your physical health is gone, it can destroy your mental health. So you need both. You cannot have one without the other. They need each other. It's a comprehensive.
So it's a side-by-side ride along, do or die. right?
Yes, it's a do or die.
Do or die. And like you said, they treat pieces of the body. The body is one whole,
The body is one whole system.
and when it's divided up like that, you don't really get the opportunity to go to a doctor because you're split between so many doctors, and you don't really get a concise treatment plan. You get a broken up plan, and that's kind of dangerous to a lot of the patients. Next, we have addressing health disparities. Now, that word disparity,
I hate that word disparities. I really hate that word.
and a better word for hate is what?
Abhor.
That's a better word for hate. For hatred is abhorred. So we'll use the word abhorred. So tell me what you dislike about addressing healthcare disparities.
The word disparities to me is another English word for, again, I'm going to make it simple, closing that gap.
Closing the gap, having discrepancies, a difference. Yes. And so how did Bernie champion that section of the Healthcare Act?
He championed it by giving health care coverage to everybody, regardless of where you come from, socioeconomic, your race, and income, regardless of income. Because if you have horrible health care, it can lead. It's the number one cause of bankruptcy in the United States. Is medical bills.
And they also advanced it to rural populations. He advocated for policies that aim to reducing these gaps or discrepancies or differences and improving health outcomes for Americans. And there's another word that we talk about, marginalized communities. What does marginalized mean?
That means you're not important, ignored communities, which is beige and brown communities and other different communities,
Asians,
Indians,
black and brown,
Native Americans, which the Native Americans built this country in the first place, but that's another subject for another time.
Absolutely. And when you're marginalized, you're just invisible.
You're just invisible. They don't care about you. They don't really care about you. You're not a profit to them. Just hurry up and die. You cost too much.
You know, I want to tell this right quick. I remember when we were going through a diagnostic process, you know, when people say about processes and content. And so the person might be the content, right?
Right.
And what they're going to pick or choose or how they're going to execute something is the process, right?
Right. That's the process. The content versus process.
So we were going through this process of getting diagnostic assessments. And I remember a doctor standing out in the hallway, and we were talking about mental health. And this doctor, I said, this is unbelievable. This doctor just came out, just blatantly said, I was kind of giving him a kind of background of my medical history. And I am a cancer survivor, and I always tell people, you know, a lot of times you can survive something, but who said you heal from it? Because it's a mental process that you go through.
Not only to survive, but to thrive.
Absolutely. So in the process of telling this doctor what I had went through, and when you was getting the diagnostic assessment, he stood there, looked me straight in the face, and he said, well, the good news, well, kind of the way you want to look at it, is when you have your particular illness, physical illness, well, you don't be around long, and especially with cancer. I said, I don't believe this man is standing here telling me this.
Mm-hmm.
But he said, with mental health, it's
it's a long process. We don't want to treat it too long. Just hurry up and die. Just lock them up, hurry up and die. Medicate them, do something. It takes too long.
It takes too long. But yet and still, I was standing there and it was like, well, you'll be over with in a minute because you got something that's metabolic or that's going to take you out or, you know, and so you on the good end. And
you're on the good end. I'm on the bad end because it's more mental.
it's all bad when it's if we didn't have people like Bernie out there championing and putting in everything that he has worked so hard for, and having to come up against Big Pharma, who wants everybody to
to
have.
be to have just enough to control you, because if you have bad health care, you're easier to control. Shout out to Dr. Bobby Price too, because if you're trying to just to be healthy, you're like another you're being a radical as another Black Panther.
Absolutely. And everybody knows medication is not a quick fix. And the most important thing that I want people to remember about pills, they have side effects. And even on those side effects, they're not nobody's gonna step up to the plate and say you died from that side
They
effect.
use the word complications, which is another word for I'm not taking responsibility. I'm covering my own ass and saving my own career. That's what complications really means.
Absolutely. It is a that letter that they always say, we're gonna write this off. And even if I went in and they said, today you're gonna take your mammogram. And then after they tell you, well, we didn't see it. Your breast is dense, okay? And we need you to take another x-ray. And you take that. And then that CYA letter, that CYA, which is cover your assets, then they'll say, well, I hope that you continue to come. And although we did give you two of the processes of looking into your chest cavity, we still want you to continue to check and feel. Well, what was the process of your machines? It didn't see nothing.
What's the point of your machines?
Right.
I just don't want to be sued. That's just what it is. I just don't want to be sued. And I want to go to my golf game.
And it's all about checking those bubbles.
Yes, it is. It's about checking those bubbles.
Absolutely. Now we get to the fifth one, protecting Medicare and Social Security. Oh my God. Here we go with the youngsters on AARP and our Blue Zone president. Go for it.
Well, Bernie Sanders championed not only protecting Medicare and Social Security, he wanted to expand Medicare and Social Security. So that way you can retire with dignity and health with dignity.
And you know what? Who is constantly blocking? Who is constantly trying to pass bills and block?
It is the conservative, it's the radical Republicans, they're not conservative Republicans, and the corporate Democrats that is allied together, that is blocking of expansion of retirement with dignity. Some even want to privatize Medicare and Social Security. Privatize it, like putting Social Security in the stock market. Bad idea. Remember when George W. Bush used his political capital to privatize Social Security and personal savings accounts on Social Security?
Absolutely.
And then Paul Ryan talked about with Medicare having like health savings account. Once you hear the words health savings account, that means privatization. You're on your own sucker. Okay? The average limit on healthcare for health savings account, which I'm being facetious here, is $6,800. The average Medicare is way more than that. $12,500, just to be more conservative.
Well, I appreciate you calling the Slim Shadys out. And those Slim Shadys were Paul Ryan and who else?
It was Paul Ryan. It was Senator Joe Lieberman, because before he wanted to expand access for all, but he blocked Medicare for all, lowering the age to 54 for Medicare just for spite when he lost that Senate primary to Ned Lamont. That's now Governor Ned Lamont in Connecticut.
Oh, we don't want to leave out.
And we don't want to leave out our other favorite corporate Democrat, Christian Sullivan and Joe Manchin.
Well, you know, we got to have a balance here, because they'll say, well, they're just calling out all the Republicans. Well,
they're corporate Democrats. I got something for them corporate Democrats too.
Okay. So, and we don't want to leave out Slim Shady, Mighty Woo, Mitch.
Man, and oh yeah, my favorite, Mitch McConnell from Kentucky. Oh boy.
Well, Mitch is a whole new chapter,
Yeah,
another
that's a new
story.
chapter.
But you know what? What I really like? I really like that scene where Ari was showing the unity between Bernie Sanders and our Blue Zone president.
Joe Biden. And he's a blue zone with a blue zone president.
Well, you don't see that unity in the Republican on the Republican side, do
No, they
you?
don't, because they know that the predecessor is going to a dictatorship.
And look how they're clearing out quickly on the Republican side, and they're losing all their people. And even the staff people are leaving.
Republican and Democrat. It's the poison in Congress, too. It is only getting worse. And the people are getting worse. People like Lori Boebert, Tara Marjorie Greene, Laura Noma in Florida. It's getting worse. Senators Ted Cruz and Josh Hawley in Missouri, J.D. Vance in Ohio. And we're seeing some worse and worse candidates coming.
Right. And shout out to Mika and Joe for calling out all the Slim Shadys and saying that, you know what, you all need to go in there and step up and say what the predecessor has done, because we are under constant threat. And mental health is on the rise thanks to
Thanks to these corporate Democrats and allies with the radical Republicans.
right.
And they're not conservative Republicans, they're radical Republicans.
Radical.
They want to take us back to the 1800s, the Gilded Age. There is nothing conservative about Republicans, because if you look at the definition of conservative, the definition of conservative means to conserve, status quo, no change whatsoever.
You know, now Secret Agent Rara, her favorite word years back when she would be reporting, she would say draconian. Do you know what draconian means?
That means harsh policy.
Harsh, old, ancient policies, you know. Right. Well, I think this went really well today. So, would you like to give us the last word like Lawrence would give?
Yes, I would like to give the last word. We as citizens need to help Bernie Sanders out by being your own healthcare advocate ourselves. That means eating properly. That means not only eating the right foods, reading the right information, going to the right places.
Right. And so, I
And
absolutely.
having the right friends and promoting the blue zones to help Bernie, because Bernie cannot help it alone. If you need some help, listen to a song by Michael Jackson's Man in the Mirror. By Michael Jackson. Listen to it, look at yourself in the mirror, and be the change that you are. Because the white knight is not coming. The savior is not coming. You're your own savior.
And Eric Holder said, if you're waiting for him to come, you better think again. You better get off your horse and dust your butt off and, try to do what? Save yourself.
You gotta save yourself.
And the fight is on.
The fight is on. Stop looking to other people to represent you. You're your own best interest. You're your own advocate. And you got to eat right and correctly, because here's two sides that you're on if you don't eat right. It's either you're with Big Pharma, or you're going to pay with Big Pharma, or you're going to pay Farmer John. And I know which side I'm on. I'm on the farmer side and the small business side.
As they say, do your share. Bernie has worked very hard along with many other people that helped him come up against Big Pharma.
Big Pharma and big drug companies like Bernie Sanders and Elizabeth Warren. We have to help these guys and vote out the corporate Democrats that are obstructing progress.
And if you're on the patient end needs to advocate for their life.
Advocate for their life and stop waiting on the doctor to save them, because a lot of these doctors, they're not on your side. They don't really care about you. It's like they say, these doctors ain't loyal at all.
And a special shout out.
And special shout out to the functional doctors. If the only doctors that I am in favor of is the functional doctors. That is it. Stay away from the traditional doctor. If you have a traditional doctor, fire that traditional doctor right now.
That's what a second opinion is for. And before we close out, and we said giving you the last word, and we still on, we're gonna give a special thank you to KU Med Center. It's been how many years now?
It's been 35 years. I was diagnosed at 4 years, 10 months. I'm 35 now. It's been 31 years since that diagnosis.
And you have done an exceptional job. And we're going to have a fabulous story coming out, because one thing that diagnosis did, it put us on target for this particular election year, and it helped us to call out our Slim Shadys. So, anything else, Bondale?
Before we go, I would say subscribe. So me and Miss Ballard of 911 Health and KG at KG Television can grow. Subscribe so truth and integrity can grow. Subscribe so we can stop the lies.
So on that note, thank you. And you'll be seeing us and hearing from us soon. And we're out.
And we're out.